pitfalls of robot doctors. Doctors use computers to keep medical records, while practicing medicine. Laparoscopic cameras to view patients' guts and centrifuges for blood tests. Technology and the development of artificial intelligence are moving closer and closer to robots that can thoroughly serve humans on a daily basis, including in the medical field. What will happen in a future society where the computers become the doctors? With every advancement, there are drawbacks also. A robot general practitioner's memory is preloaded with every known illness in the history of Homo sapiens, and a robotic surgeon could more precisely cut away dangerous tissue than a human hand. But both of them still requires a human master. Unless the technology is practically perfect in every way, there will be problems. A medical robot listens to a patient's list of symptoms and compare with every related illness loaded in its catalog, eliminating choices based upon patient history and listing the remainder by order of likelihood. But what happens when a patient cannot properly communicate the problem? Due to a lack of understanding of the issue or because he used incorrect terminology? A robot cannot understand how laypeople communicate health problems. The intelligence to ask the right questions and the ability to pick up subtle gestures and cues used as two people talk. Cold hands may sound funny. It's uncomfortably chilly when a human doctor touches a nude body part during a physical examination. No matter how realistic a robot physician's skin looks, it's doubtful the extremities will be even as warm as the cold-handed doctor examining a patient. Even the most advanced humanoid robots, such as STAR, the first autonomous robot that performs surgery on its own, is made out of metal. Robots with medical degrees would need electricity to function. But in the event of a massive power outage, the robot's battery will ultimately stop, and people don't stop needing emergency medical treatment just because their doctor has run out of battery. Humans, however, are able to continue serving patients even when a grid goes dark. They use the light of his cell phone to perform medical procedures even the hospital didn't have electricity. A similar scene occurred in India recently. A power outage forced a hospital to operate largely by candlelight and they used candles and cell phone flashlights to deliver a baby. Having human contact is important, and a lot of people don't get enough of it. The absence of human contact has been noted in prisoners in solitary confinement, who experience severe mental symptoms like hallucinations. There are also physical effects of loneliness. Chronically lonely people have higher blood pressure, are more vulnerable to infection, and are also more likely to develop Alzheimer's disease and dementia. Loneliness also interferes with a whole range of everyday functioning, such as sleep patterns, attention and logical and verbal reasoning. Social isolation unleashes an extreme immune response, a cascade of stress hormones and inflammation. Social isolation has been shown to negatively affect lifespan. Patient who would be most affected by going to robot doctors would be someone seeing a psychiatrist to be treated for depression. A more general situation would be someone who is scared to undergo a particular medical procedure. Humans can provide comfort in a way a robot never could, for example, holding a patient's hand as they nauseatingly fall into the unconsciousness of anesthesia before a surgery, or knowing what to say when delivering a terminal diagnosis. Thanks for watching.